I knew I had a problem. I would wake up in the middle of the night. I had some chest pain. My doctor, my TriHealth doctor, she recommended that I go and have a echo done. And then that led to, having to see the cardiologist here.
She only recently, at the time I had seen her, started to develop symptoms of aortic stenosis. Aortic stenosis is when the valve that separates the heart from the rest of the body becomes calcified or stiffened and just doesn't open correctly anymore. It's very common, but when it happens, it can be an intimidating and certainly a frightening condition to have. She was just starting to get symptoms of shortness of breath with exertion, some chest discomfort, but those are warning signs that we look for, and they're indications that we need treatment.
I had to come back and talk to Dr. O'Keefe, who was the surgeon, and she said that she explained the process to me. What I really looked for in her was the confidence that she exuded and that she was the expert. And, coming from an educational background, I knew that she knew her stuff, just the way she presented herself. And when she presented both cases, she did not try to convince me one way or the other. She said, the choice is yours.
This particular disease, if left untreated, is fatal. And so the options that we discussed were surgery, open heart, with Dr. O'Keefe, one of our heart surgeons, or the TAVR, which stands for Transcatheter Aortic Valve Replacement, is where the physicians put a heart valve into the aortic valve without having to do open heart surgery. We put a large tube into usually one of the arteries in the groin. The tube actually goes up to about the middle of the abdomen. And then through the tube, we have a valve that comes essentially collapsed on top of a balloon. And we're able to push that all the way up to the patient's heart, put it in position. We can inflate the balloon from outside the body, and that deploys the valve. It actually smashes the old valve out of the way. It's held wide open by a metal stent or a cage, but on the inside of the cage is a brand new tissue valve that opens and closes normally. And it's the same tissue that the surgeons use when they do open heart surgery. But the benefit, of course, is that our procedure typically takes about an hour, and our patients often go home the next day.
Of course, the TAVR was a no-brainer. Who would not have that done? So I said, okay, let's schedule it. Well, they had me scheduled in 2 weeks. The thing that convinced me to do it was Dr. Rapp. He leaned into me and he said, I really recommend that you do it. And it was his personal, his genuine care that convinced me. They gave me confidence, like, okay, let's just go do it. The doctors were very supportive and caring the day of. Fortunately, the anesthesiologists made sure that I didn't know anything. The night went well, the night nurses went well. The next day they came in and by 10 o'clock they said they were going to release me. Unbelievable, 24 hours. The process was 24 hours.
We can fix patients' valves and treat their symptoms, and they can go home with a Band-Aid instead of the traditional sternotomy, 5-day hospitalization, the extensive rehab, and all the work and stress that goes with that.
It's helped give me a lot of energy. I walk with my neighbor, and she said she can tell a huge difference in my walking, and I'm sleeping all night. That's the other big thing. The whole cardiology group was just amazing, and I'm more convinced than ever that, this is the hospital to do it at.
Age is not an excuse. A lot of people think that I'm 70, I'm 80, or I'm 49, and I just can't do what I used to do 10 years ago. While that might be true, there are other reasons, and they absolutely should be investigated. What I would say to patients who have symptoms or who just don't feel right, or who even might have an inkling that something might be wrong, is don't ignore it. We have amazing techniques these days. It's just incredible the things we can do for people. And patients do better when we find these problems earlier.
I would say to anybody who's thinking about it, go TAVR first. TAVR first, because that's the most perfect way to get yourself healed and moving on with your life, moving forward.
This is something that, if left untreated, has a worse mortality than cancer. So the fact that she does know her body and that she did recognize that something was off not only allowed for her to feel better sooner, it may have prevented long-term complications for her.
You can just expect to have high energy, sleep at night, which was so important. Going up the steps, probably once in a while I'd feel a little winded when I went up and down, up and down, up and down. Now I don't. So all those are good results, and you want to be here longer for the people you love.